good evening, distinguished guests, speakers and doctors. And it was a pleasant surprise for me that when I landed up here, Dr. Ravi told me that, hey doc, can you just give your a little bit of experience with Danshen. Now if you look at the reasoning why as a doctor, of course being an allopathy, I should tell you that I'm an ENT surgeon with 22 years as a doctor. Now if someone comes and talks to me and tells me, hey doc, there is some herbal preparations or alternative, I rather would refrain from going into it. The only reason is that, is it FDA approved or not? Because for us, the main team or the group which has to say you can use it is FDA. For an allopathy doctor, it is the one. And when I heard that parsley has something to do with the FDA and they have applied for a clinical trial, I said there is something. Up to 2008. Even today, recently, last week or 2 weeks back, I did pick up my clinical trial which I have individually done on my individual patients. I have documented it. I will give the Danshen to my patient and record it. What date, what are the improvement after 1 week, after 2 weeks, after 3 weeks, after 4 weeks. And of course, I do consume Danshen once in a week. Yes, I do consume. But initially, I did take twice a day. And as of today, I'm very healthy. I have no problems. So in that way, what is that which really attracted me to this parsley, which is now parsley, is number one is the microcirculation. Let me tell you, in the whole world, I can boldly talk about this. There is nowhere in an allopathy way you can tell that there is a microcirculation and there is a machine which can see your microcirculation, and this is the problem you all have. I have never come across. It's the first time in my life I come across, hey, this company is showing me something, a beautiful microscope wherein you put your hand and you can see the circulation live. It attracted me, hey, there is something very beautiful. In fact, my heart even now goes that every doctor should learn this beautiful technique of microcirculation and implement it in our day-to-day practice. Why not? We should. There is no reason why we should not. Number two was, when I visited China, Beijing, wherein I went to Tianjin province to see the company, it's marvelous, ultimate. There is no doubt about it, it is one of the top line companies in the world. Even though it might be a traditional medicine, I salute Dr. M who is doing a wonderful job of making it perfect to every soul in this universe, that they all should be helped in one way or the other way. And when I could see with the microcirculation, there is some benefit. And this was the first product in the world. We are talking about a microcirculation being improved. But today I can boldly tell Danshen is one of the top line product even today for my patients. And I have one of the top line testimonials. One patient was admitted in the ICU. Suddenly it was on December 12th, I think, 2007. His wife is crying and calling me, hey doc, do you have anything which you can help me? It was a Monday morning, and Tuesday the doctor said he has to go for an emergency bypass operation. And Monday morning she did call me and say, hey doc, is there any way you can help me? I said I wouldn't be able to assure you, but why not try this? So I put 2 capsules of Danshen 3 times daily on Monday, and Tuesday morning this guy gets up and said his pain has relieved. He was in the ICU. And then what this gentleman boldly has told the doctor, doctor, I don't want any operation for the timing, can you give me 1 week? And the doctor said, no, you have to, but he said, no doctor, I am not interested in going for the operation, give me 1 week time. And this beautiful guy, what he did was he took the capsule 2 capsules 3 times daily for a week, and after that he went back home. And today, I can boldly say that this guy has not gone for the operation, and he had 6 blocks, all cleared, you know. And one of the beautiful top line testimonies in my was, this was in an ICU. And even today he is still consuming the thing, almost 5 years now, he is still consuming. And there was another girl who had juvenile diabetes and uncontrolled, and her one vision totally out because one eye was already gone, there was other eye blurring. And this girl